Pregnancy, giving birth and caring for your newborn baby is a huge life event.
Many parents find it hard to talk about any negative feelings because there is often pressure that it should be a happy time.
We're constantly shown images on social media and on the TV portraying happy family lives, and when we don't feel like this, people can feel a huge sense of guilt and shame.
Some of the thoughts and feelings that can arise may be frightening, but support is available to help you understand and manage what is happening.
So I'm wondering, Libby, what it was like to actually ask for help.
I felt really vulnerable, actually. I didn't know really where to turn, and I couldn't stop crying, and I was talking to friends about it, and they sort of said, you need some professional help. And I was a bit concerned about the judgment around it, because I think there's still a lot of judgment around mental health and the stigma attached to that. So to say actually I've got depression or anxiety, or I'm not coping with my child that I've just given birth to, then what will the repercussions be? Yeah, that initial phone call to the health visitor, and I did feel that you listened, and I felt, I suppose, reassured after our conversation that something was going to be put in place for my mental health, which I was quite relieved about.
We know that around 10 to 20% of parents during pregnancy and the first year after birth are likely to experience a challenge with their mental health, and being aware of this can help.
Having the baby blues after giving birth is very common. It usually starts when your baby is about 3 days old and stops by the time your baby is around 10 days old.
Symptoms can include bursting into tears for no apparent reason, feeling irritable and irrational, feeling down or anxious. These feelings are normal and occur because your body is going through lots of hormonal changes. If after 10 days you don't feel better, it may mean you need extra support.
Being extra kind and compassionate to yourself will help you recover and build emotional resilience. This includes being realistic about who needs to visit after your baby is born. Be careful not to overwhelm yourself, as the early days and weeks with a baby are precious.
If people are offering to help, let them.
Asking for help doesn't mean you're not coping. Most people benefit from a helping hand and will mean you can focus on caring for you and your newborn baby.
You will need time to sleep, eat, drink, and get some fresh air and gentle exercise. These are essential needs that can easily be neglected when caring for a newborn.
Real life with a newborn will have moments of magic, but it is also tiring and demanding. Your routines will change and everything will become centred around what your baby needs when your baby needs it.
This can be very stressful, especially when you're tired and are giving them everything, but they still cry or don't want to be put down. When these stressful times arise, doing a very simple breathing exercise can really help.
There are a range of thoughts, feelings and behaviours that may indicate heightened anxiety, low mood, or an existing mental health problem is getting worse.
These may include not enjoying activities as you once did, feeling sad and worried as though something awful might happen, having scary thoughts about harm coming to your baby, or changes to your eating and sleeping patterns.
You may feel extra angry and irritable, and others may have noticed. These are just a sample of the negative emotions you may experience, and although no one is happy all the time, it's important to seek help. If how you're feeling is stopping you from caring for yourself or your baby as you would like.
The good news is the quicker you ask for help, the sooner you will start to feel better.
The 5 ways to wellbeing are things to think about to help you look after your physical and mental health.
Connection is making the effort to connect with others even if you don't feel like it. A short chat with a friend or even a stranger can make you feel less alone.
Be active. Exercise can be a powerful mood booster, and being around nature can really lift the mood and lower stress.
Take notice, stop, pause and breathe. Use all your senses to notice your environment. Slow down your eating and really taste your food.
Learning. Having a baby is an opportunity to learn new skills. Your local children's centre will have courses such as first aid or parenting that will help you feel more confident about caring for your baby.
Give. Helping others through an act of kindness helps our own well-being.
It's an important part of a health professional's role to care for your mental health.
If you need support, it's okay to ask. You can contact your GP, health visiting team or midwife or Sussex Mental Health Line on 0800 03 09 500 or the Samaritans on 116 123. Both of these services are available 24/7. There is also PANDAS, which is a national charity who offers support for postnatal depression, and Mind Mental Health Charity, who have an excellent website with lots of information on perinatal mental health.
We're here for you and your baby.